Hello, I'd like to talk to you about kidney health related matters. Perhaps you have seen or known people who have come down with kidney failure. It's a devastating disease, not just in terms of the toll, physical toll, but also in terms of economic toll. You can spend tons of money and you're really only able to keep your head above water. Now, you also may be aware of factors that cause kidney damage, hypertension, diabetes, inflammation of the kidneys, what we call glomerulonephritis, are the most important factors in our environment. Then more recently, there is the talk of the genetic abnormality known as a mutation or abnormal damage to a particular gene called APOL1 gene. Now, historically, APOL1 gene was involved in protection against parasitic infections in West and Central Africans. But an abnormality in that gene, what we call a mutation in medical science, transform that gene into one that codes for proteins that actually trigger or increase the risk of chronic kidney disease. Just like all genetic proteins or genetic factors, it's inherited. You inherit one from either parent. Now, if you inherit one normal gene and one abnormal gene from one or two of the parents, you're unlikely to develop this chronic kidney disease or increase your risk of chronic kidney disease. But if you do develop two abnormal genes, in other words, one abnormal from each parent, then that increases the risk of developing chronic kidney disease. Apart from the traditional risk factors I talked about, hypertension, diabetes. Diabetes is especially more important in Western countries, whereas in our environment it's predominantly hypertension that is the number one risk factor. Diabetes is more recently becoming increasingly important in this environment. Now, the other risk factors which have not really been given due attention in the environment is the abuse of painkillers. Especially the ones we call non-steroidal anti-inflammatory drugs like ibuprofen, Atrotec, Celebrex, and the like. When you take such medications for pain over a long period of time, you tend to develop what we call interstitial nephritis that can lead you to expose to chronic kidney failure. Now, unfortunately, these medications are purchased over the counter. People just walk into a local pharmacy shop and they're able to get it, which ought not to be so. Then again, there is a condition called chronic kidney disease of unknown origin. That was recognized about 3 decades ago in South American countries among plantation workers. And it's typically associated with chronic exposure to intense heat among farmers and other occasional duty related to exposure to sunlight. So the intense heat and dehydration that result from that actually trigger kidney damage over a period of time. Now, how that happens is that your kidneys are the very unique organs in that they receive about a quarter of your cardiac output. That is the amount of blood that your heart pumps every minute. So 25% of that is received by the kidneys. So if your blood volume is reduced, in association with dehydration, that amount will drastically reduce and impact kidney function. And that's why we have this chronic kidney disease related to exposure to intense heat. I used to be called Mesoamerican nephropathy. Now, the kidney disease, like I mentioned, is very unique. There are 2 of them. You have a pair of kidneys. But most times the chronic disease we talk about that cause kidney failure actually affect the two kidneys simultaneously, although you can actually live with one kidney. And that's why people can donate their kidneys to those who have kidney failure and live a normal life. So diseases that affect kidneys most times affect the two of them simultaneously. So what's important is to ensure that you avoid factors that can trigger chronic kidney damage. If you're hypertensive, get it controlled. If you're diabetic, ensure that you're seeing your doctor and taking your medications so that these conditions are controlled. That will drastically reduce your risk of developing chronic kidney damage leading to chronic kidney disease. I will also say that even though we are talking specifically about chronic kidney disease, there's also another type of kidney disease called acute kidney injury, which is kidney damage in the short form that you can get from severe loss of body fluids, such as bleeding or vomiting, that's or diarrhea. And if that can recover within a period of less than 3 months, if appropriately treated, and you don't progress to the one that we call chronic kidney disease, which eventually leads to end-stage kidney failure if not even treated adequately. There are tools now that help us to delay the development of kidney failure from chronic kidney disease. Some new medications, especially going along with your control of adequate control of blood pressure and getting your blood sugar under control, as well as controlling other risk factors. And more importantly, I want to emphasize the need to avoid self-medication. It's very important to avoid self-medication because recent studies in Nigeria have shown that it is one of the important causes of chronic kidney disease and chronic kidney failure in this environment. And then again, it's important to be proactive. When you see a doctor for any reason, usually they will check your blood pressure. You have to know your numbers. You don't just leave information to the health team who have attended to you. Make sure you know your numbers and get advice as to how you can improve if numbers are abnormal. Now also, you can actually, apart from knowing your numbers or checking, parameters like blood pressure and blood sugar, urine protein or assessing for protein urine is another important tool for evaluating if one has developed chronic kidney disease or not. And it's a relatively cheap investigation to carry out. So if you're hypertensive or diabetic, ensure that whenever you visit the hospital, they check your urine for protein. And sometimes it might also go along with blood and urine. Those abnormalities that will raise a red flag that needs to be thoroughly investigated so that you don't end up with chronic kidney disease or kidney failure ultimately. There's so much to talk about these factors, but I just want to kickstart this talk with giving you insights into what I call understanding and preventing kidney failure. I hope this has been helpful. Thank you. God bless.